Healing the Broken Brain. Leading experts answer 100 questions about stroke recovery. It's a book by Dr. Mike Dow and his brother David. In it, they talk about the best ways to recover from stroke and what measures to take in order to prevent them. Dr. Mike Dow is here with us this morning. Thank you so much for being here, doctor. We appreciate it.
I appreciate
it.
So
it's fascinating to me because your brother suffered a stroke at just 10 years old. What was that like for him and your entire family?
Yeah, that's right. It was a massive stroke at just 10 years old, sort of out of nowhere. Now, in my brother's case, it was the result of a rare brain disease. For most other people, and I think what's really interesting is that for young and middle-aged adults, strokes have doubled in this country in the past 10 years. So stroke is no longer your grandmother or great-grandmother's disease. More and more, we're seeing younger people affected by stroke, which is why we really wanted to write this book, because it's important knowledge.
And this is a picture of you with your brother here that we're seeing.
That's us.
So how did that affect your entire family?
I mean, it was absolutely devastating. You know, everything changed. A stroke of his magnitude, he was unable to write, walk. Doctors told us that he should be put in a nursing home for the rest of his life. And I can tell you now, because of a long, hard-fought recovery, he is living a happy, independent life. And we talk about our story, what my brother did to recover in this book.
And you know, you've done a lot of research. What actually happens to the brain during a stroke?
Yeah, so strokes are either about a clot or a bleed. So usually it's a clot, that's about 85%. And the brain is actually losing oxygen. The brain is so fragile, right? And we know that there are so many risk factors. People know what the risk factors for heart attack are. They know if you eat cheeseburgers and drink soda all day,
Right.
that you're gonna gain weight and you're gonna increase your risk for diabetes. Well, guess what? Having high blood pressure, having extra weight in your midsection, having high cholesterol, those are all going to increase your risk for stroke as well.
Even in a young patient?
Yeah, absolutely. And that is why, actually, in this country, more and more younger people are having strokes. It's our lifestyle. It's what we're eating every single day.
Let's talk a little bit more about diet, because that is something that we can control, that we have, you know, a say in our lives. What are some of the things we've seen studies about diet soda maybe contributing to stroke? What does your research say, and what are you seeing in terms of what you can avoid or eat in order to prevent a stroke?
Yeah, so there's one thing that I have to shout from the rooftops. It's what I wrote for all people in my last book, The Brain Fog Fix, and it's what I recommend in this book for stroke survivors. It's a modified Mediterranean diet. In recent studies, we know that people who follow this diet, this Mediterranean diet, can reduce their risk of stroke by about 30%. We're also seeing a similar reduction in risk for brain fog, dementia. So if you're going to go to your kitchen cabinet tonight, if you have corn or soybean oil, get rid of that, replace it with olive oil. Cut out red meat. Eat a lot of fish, white meat. Make sure you're getting 5, or I would say 7, servings of whole fruits and vegetables every day, and beans. Beans are great because they're affordable. And when researchers looked at what parts of the Mediterranean diet really help the brain to grow, fish and beans were the first two. So it's really some easy, simple changes we can all make to better our brain health.
Yeah, and not just brain health, but overall, it sounds like.
Oh, you're gonna feel better.
Yeah.
It actually improves mood as well. If you're struggling with depression, this diet has been shown to help put people in remission. So I think it's just incredible.
And what are some of the advances you've seen in the field of studying stroke?
It's really exciting. There's TMS, transcranial magnetic stimulation, TDCS. These are sort of electrical or magnetic impulses that are applied to the brain that can help speed up recovery, and stem cells. So just in the past few years, clinical trials are, you know, in this last one, they injected stem cells directly into subjects' brains, and almost overnight, people who couldn't walk were walking again. So I think in the next 10 years, it's a really exciting time. And it's not about we're going to get rid of all the treatments, the occupational therapy, the physical therapy. It's that we're going to be combining those older tried and true therapies with these new groundbreaking therapies.
Very exciting.
It is exciting.
Thank you so much, doctor. We appreciate your time, and the book looks very interesting. Again, that book is called Healing the Broken Brain. Leading experts answer 100 questions about stroke recovery. It's available wherever books are sold, and we will be right back.